Hi, my name is Dori Clesis, and I'm with the Mount Sinai Health System in New York. Today, we have the pleasure of speaking to Dr. Dariush Mozaffarian, cardiologist and dean of the Tufts Friedman School of Nutrition, Science, and Policy. We're with Lindsay Condrat, who's a nurse practitioner with Mount Sinai. So, thank you both for joining us. Lindsay, tell us about the work you're doing here at the Mount Sinai Health Concourse.
Thank you, Dory. So today we're doing, actually during the entire festival, we're doing heart health screening. So we're taking your blood pressure, your cholesterol. We're also doing height, weight, and calculating a BMI, which is a body mass index.
Terrific. And what about the numbers? Do you help coach and educate folks when they complete their test and go over that, and then they go see their doctor if necessary?
Absolutely. We're coming across some high levels or high blood pressures, and we're able to counsel them and tell them a little bit about diet and exercise. And of course, if there's anything concerning, we refer them back to their physician in the area that they live.
So, Dr. Mozaffarian, you are a cardiologist. So the patient would actually bring back the numbers if they're in any way elevated or there's some warning signs. And then how would you address those numbers?
Well, I think one of the most important things for me is to think about, health holistically. And so blood pressure and cholesterol and glucose and weight are, important, but diet and physical activity and smoking are equally important, not just means to an end. And so when I worked with the American Heart Association, we talked about Life Simple 7. So independently, you need to, so I think screening should be across all of those things. And diet in particular is really the elephant in the room in our country for type 2 diabetes and weight gain and cardiovascular disease. And so for me, I really focus on diet as the most important thing. And then of course, on top of diet, you can give medications and other things, but it's really amazing with proper counseling and actually evidence-based science, how much somebody can improve just by changing their diet and lifestyle.
So, what exact role does the diet play? You talk about a good diet and a bad diet, calories that have, good calories, bad calories. Can you talk a little bit about that?
Yeah, I think one of the biggest, misperceptions that's been part of recommendations is eat everything in moderation and don't eat too much and count calories. And I think that that's a notion that all we have to do is kind of just eat some of everything will be okay. And what we've learned is there are some foods that are actually really good for you and you should be eating a lot of and indulging in. And there are some foods that are kind of neutral and, eat for fun and to make your diet more interesting and varied. And then there's some foods we really should be avoiding. So the opposite of the everything in moderation approach. And while there's still a lot to learn, the most important foods are what I would call minimally processed, bioactive rich foods that give rise to life. If you plant them in the ground, they will sprout into a new plant life. And so those foods are what our bodies need with aging. And so beans, whole grains, fruits, nuts, seeds, the oils from those foods, and even vegetables. Most vegetables are actually fruits, olive oil, avocado, pumpkin, squash, tomato, cucumber. So all of those are foods that give rise to life. And if you add yogurt for the probiotics and fish for the omega-3s, that's a really healthy diet. And then the kind of the neutral foods, cheese, butter, poultry, milk, eggs, they're kind of neutral, enjoy those as well. And unprocessed red meats, up to a serving or so per week is probably also relatively neutral. And then the worst thing in the food supply is actually the hyper-processed starch and sugar-rich foods. And I really emphasize starch because people kind of get and understand to avoid sugar, but they still miss starch and they think starch is okay. And as just examples, cornflakes or most breakfast cereals might have no added sugar, but they're all starch, 100% glucose, and white bread and white rice. And so I think thinking of starch and sugar as, sides, as treats, just like candy, really is important. And if a person can do all those things, they can get a much healthier diet. But for many people, including, low-income patients, we need to help them with policy. We can't just rely on their own choice.
Thank you. Lindsay, here at the Mount Sinai Health Concourse, when the participants come, they can just step right in and see a nurse practitioner and kind of tell us about the process.
Absolutely. So we take your blood pressure, height and weight. We also do a quick finger stick, which actually gives us an HDL level, LDL, triglyceride, and a total cholesterol level. The test takes about 7 minutes, and then you can be counseled by one of the nurse practitioners in the booth.
And the counseling, I've done it myself, is quite one-on-one. You look at the numbers And sort of, and do you talk about nutrition, let's say?
Absolutely. We talk about nutrition, we talk about preventative health, we talk about exercise, we talk about annual physicals, which people often they aren't doing. So we talk about compliance with health regimen as well.
Dr. Mozaffarian, what about fat? I've read that there's two kinds of fat, a good fat and a maybe protective fat. Can you give us a little bit on the science on that?
Yeah, so I think that fat, of course, there's many kinds of fatty acids. There's big categories: unsaturated fats, saturated fats. But even within those categories, there's dozens of individual types of fats and fatty acids, and we're learning that they're all actually a little bit different. So rather than thinking about fat as a class, it's more important to think about healthy foods. And I actually think we should be increasing the fat in our diets. The upper limit right now recommended in the United States is no more than 35% of calories from fat. I actually think that should be the floor, that we should be eating 35 to 45% of our calories from fat, mostly healthy fats. And so what are healthy fats? They're basically fats derived from all those same foods that give rise to life: nuts and seeds, plants. We call them vegetable oils, but there's actually no vegetable oils. They're all fruit oils or nut oils or seed oils. Avocado oil is a fruit oil, olive oil is a fruit oil, canola oil is a seed oil. So eating all those healthy plant oils, avocados, fish as whole foods are really quite good for us. And then that replaces the starch and the sugar. Now, dairy fat's actually a very interesting area where in many studies now, observationally, people who eat more dairy fat actually have low risk of diabetes. Whether it's the dairy fat or something maybe about cheese is the number one source of dairy fat, is still unclear. And we traditionally have thought of cheese as a bad food, but cheese is fermented, and especially hard cheeses, aged cheeses, and the fermentation induces many changes in cheeses that could actually reduce diabetes. And so I'm not saying we know that cheese reduces diabetes, but this is one of the really interesting questions: is what's the role of dairy fat? And that's important because, for example, in the US school lunch program, which is generally excellent, whole milk is not allowed because of the dairy fat, but skim chocolate milk, sugar sweetened chocolate milk, is allowed. And that was a policy that was set in place by very smart people who were trying to protect kids. But is that really the right way to go? And I believe maybe we should be rethinking fat.
Lindsay, let's talk about policy guidelines, government guidelines. You are abiding by them and sharing them with participants. How quickly do they change? Is it every 5 years, or tell us a little bit about what happens in heart?
The guidelines are really changing every day. I mean, I feel like there's breakthroughs every single day in what we do and what we learn. But really, the most recent guidelines for cholesterol just came out at the end of 2018. The American Heart Association published them, and we were able to really learn a lot about HDL from that and about how we're prescribing medications.
Terrific. And one final thought for both of you. I mean, how quickly is the science changing, and can the regular person learn and use that information, or do you need some time to go by so the scientists can decipher it?
Well, so the science is changing across all fields, and so how we treat heart attacks, the medications we use, how we treat calcification of heart valves, all of that changes every day. But publicly, people notice the nutrition science changing. And so nutrition science isn't changing faster than any of the other sciences, medical sciences, but it's very public, and people notice when we say, oh, coffee was bad for you, now maybe coffee's good for you, or chocolate was bad for you, but actually cocoa's a bean, maybe it's good for you. So the science is changing rapidly, but it's not changing quickly enough. And so one of the things that some people are talking about is that the National Institutes of Health, the country's premier research organization focused on health, should maybe have a National Institute of Nutrition. It's the number one cause of poor health in our country, so maybe we should create a new coordinated strategy for nutrition research. So instead of finding out all the things we need to know over the next 40 years, we could accelerate it and find out over the next 10 years and really dramatically bend not only the health curve, but also the cost curve in our country.
Terrific. Thank you to you both.
Thank you.
Thank you.
Okay.